Hello, everyone. We're here tonight with our Let's Chat about skincare essentials. I'm Dr. Diana Bitner with True Women's Health, and I'm so excited for you all to meet my colleague, Dr. Kurt Ashack. He's just down the street from our brick and mortar clinic. And, you know, I care about this so much because my patients do. And of course, I care about my own skin. And skin has so much to do with our self-image, but also there's so many medical conditions that can tell us about our health, but that can also, skin conditions that can affect our health. So, Kurt, I would love you to tell us your story. Why'd you get into derm? Like, tell us about yourself, if you would. Why do you care?
Well, I always tell everyone I'm biased because my dad's a dermatologist, so I inevitably grew up around the field. So, it was always, dealing with our own acne and skin issues and stuff, and seeing how much he loved going to work every day got me into medicine in the first place. But, when it comes to the skin, it's such a diverse field, but it's your front step forward. People notice everything on your skin, whether they do or not, you at least notice it's there. It's a, sign of psychological health. And diseases on the inside present on the skin first. And so, it's an excellent field. We can help people out from, cosmetic concerns, figuring out if there's an underlying internal issue. And so, it's just every patient's different, and I love it.
What do you like about your day? Like when you come home and you had a really good day, like what's the most fun for you?
So I think the most fun is just, it's like I said, every patient's different. I can do, I do biopsies in rooms throughout the day. We'll do like injections and things. I see a ton of rashes. A lot of people come in with things that they don't like on their skin that we'll remove. And it's really the variety that keeps me going every day. But honestly, dermatology has been around for so long, and it was stagnant in terms of like treatments and things until like probably the last decade or so. And now there's just so much information. And in medicine, every time you're always learning, no matter what field you're in. But in dermatology, there's just so much to learn. And so, my patients teach me something new every day. And I'm constantly learning from, other providers and things. And it's just a very, changing, malleable field. But,
Sure. But what I hear you saying is how much you love, when patients have questions and you get to answer them, or they have a skin condition that makes them feel ashamed or sad, or they don't want to go out, and you get to make them feel like themselves again. That's what I hear you saying when we've talked before.
Yep. Yeah. So, and like we talked about before, so many people don't know that we exist. So, just trying to tell people, hey, like I can help you with your skincare regimen. Things as basic as that. Like people don't know when to use what product. You can like look on the internet, but at the end of the day, some of these people are just Instagram influencers, and you don't know their background. So, who better to come to than a dermatologist who learns about it?
Exactly. No, I love that. And we're going to get into some of the topics. So I say, let's dig right in. And everyone who's listening, feel free to ask questions as we get going along. I'm wearing my Got Seeds t-shirt tonight because, again, at True, we talk about the 7 essential elements of daily success, and everything goes back to these basics. And Dr. Ashack and I will talk about it. It's important to get your sleep, your beauty sleep, drink your water, and take your vitamins and all that good basic stuff. So our link to Seeds is on the side. You can go to our website and download a free Seeds ebook. But let's get right into this. I tell my patients I'm all about safety first. And so when I first think about dermatology, skin cancer is what? The number one cancer in women, certainly, probably in men as well.
Yep.
How can we keep our patients safe?
So number one, sun protection. So, and I feel like, obviously sunscreen is something we always talk about with our patients, but honestly, sun protective clothing, I think, is underrated and something we don't talk about because, plenty of people don't like, either the color of zinc on their skin or rubbing in the material. And, aside from staying under shade, there's UPF clothing out there that people can wear too. So just really, I think we've come a long way in terms of, knowing what the sun does for our skin, but just really protecting your skin, keeping things covered, and what can't get covered with clothing should be covered with sunscreen or hats.
No, I love that. And Mindy asks, can we say how much we need to use sunscreen? Totally, Mindy. I see you've put exclamation points, but I bet Dr. Ashack is going to say the same.
Yep. And it definitely, and something I hear this from patients all the time. Sunscreen is very important on the face, but a lot of people all get, my makeup has sunscreen in it. Well, okay, it does have sunscreen in it. That's right. It has an SPF on there, but what most people don't realize is that in order to reach the SPF, you have to use, probably the size of at least a nickel on your face. Unless you're caking the makeup on, you're getting like maybe an SPF of like 5, which really doesn't do much of anything. So you need to put actual sunscreen on, and then you can apply makeup, even if it has sunscreen in it. So.
No, that's nice to know. For me, it took until I got a little vanity issue. I got kind of the dark color right here in my skin. And that's what made me finally put sunscreen on my skin. My daughter's much smarter than me. She's been putting sunscreen on for years. So, I just didn't want that dark line. But in terms of skin cancer, I know there's different kinds of skin cancer. If you could just briefly, there's basal cell rate, squamous, and then melanoma, the big scary one.
Yep. Those are the 3 big ones for us, aside from Merkel cell and a couple, less common things. But so, probably the most common thing that walks through our door is basal cell. It used to be a 4-to-1 ratio, basal cell to squamous cell. Our statistics now show it's almost 2-to-1. There is more squamous cell happening out there too. But at 1 in 5, U.S. Americans will, by the age of 70, will have developed a skin cancer. And, most of my patients start developing, 1, but then I see them back in 6 months and they'll start developing more. So, all those things, especially basal cell and squamous cell, years of sun exposure. I tell everyone, it all starts as a childhood kid, getting those bad burns. Really, it starts as a childhood. It wasn't something you did last weekend. It wasn't something you might have done last month. It all starts as a childhood. And unfortunately, sunscreen didn't exist until 87. And so, really people were kind of left with baby oil and the fry outside. And, that manifests later on in life as those skin cancers.
Cool. And then in terms of melanoma, I mean, how frequently do people have to think about that? How real is that?
So, definitely real. And, whether we're getting better at detecting it versus like a true increase in incidence in melanoma, just because now we use we have what's called a dermatoscope. So we look at patterns of moles a lot more, which is kind of still becoming more advanced. But, I think people are just getting more aware. And so we do see a lot of melanoma. I mean, we catch plenty of it in the early stages, but it's definitely a real thing. And so that's why I encourage everyone, it doesn't matter how young or old, to come in and get a skin check, just to get a baseline so we can educate you more about these things.
Totally agree. Mindy, it's so funny. I was just going to ask him that same question. Is melanoma inherited? Is there a genetic link to melanoma?
There is a genetic link with melanoma. And so, one thing to kind of keep in mind that we always ask is, first degree relative, is it like a sibling? Is it a parent? Grandparents and whatnot. Sure, if there's like a ton of melanoma history and like basically every family member, that becomes a little bit more important. But more, associated is going to be like a first degree relative, not like a cousin, or some people include, like non-related relatives as well. But yeah, it is genetic, but also a lot of sun exposure. Tanning bed use, for example, doesn't matter if you did it once.
What did you say? I don't understand.
Oh, tanning bed use?
Oh, tanning bed. Sorry. Okay.
Yep. So a lot of people come in telling me I use a tanning bed, twice, but it's been 20 years. Well, that one time alone increases your risk 20%. And so that's why, if you've ever used a tanning bed, that plus genetics, kind of creates a perfect storm to develop something like melanoma.
That makes sense. And Karen asks, she's really fair skinned and has been exposed to sun her whole life. Is it frequent enough that she sees a derm every 12 to 18 months, or should she see somebody sooner?
Yeah. So for me, it kind of depends on age. Younger patients, I say, getting a good routine, whether it's every year, that's not a problem, but at least every other year, or at least within 3 years, come get a skin check. As you get older, like 40s and 50s, I encourage more frequently, but once a year is good. If you've had a history of skin cancers, though, I tend to see those people back, every 6 months, unless it's been a while since they've had anything. But just in general, once a year, if you've never had anything, is not a terrible idea.
Sure. I was just smirking because I saw your dad at another office, at Dr. Sam's office, and I said, "Oh, look at this age spot. Look at," he pulls out his little scope and he looked at it and he's like, "You're fine."
We're all hunched over with our dermatoscopes these days. Our favorite tool.
That's hilarious. I'm like, what is that?
Yeah.
So I'm like, okay, good. I don't need a biopsy. So, you guys are great. Recently I had a patient who, wanted a facial and a skin check at the same time. And she came to see your office and she was so happy. So, again, thanks for all the work you do. So topic number 2, let's get into acne. This is definitely an issue of teenage and, early 20s, but I see so many women who will start to get acne as they get into midlife and menopause. And I certainly understand that as our estrogen drops, our free testosterone goes up. Even if
Yep.
you don't measure more T in the blood, it definitely can increase acne. So
Yep.
can you talk about that a bit? What you would say to a 48-year-old woman who shows up with acne?
Yep. And that happens all the time too. And so the number one, realize that you're not alone, because I feel like plenty of women come in embarrassed because they still have acne, but we see it all day, every day, 40s, 50s, even 60s, people still getting acne. So, number one, so everyone kind of categorizes, acne as more hormonal acne, especially in adult women. But to a certain extent, all acne is hormonal. It just becomes more of a hormone predominant component later on in life, because testosterone does, help produce more oil on the skin. So, basically what I'll start out with telling people is I'll go over their skincare regimen, and then I have like a little acne handout sheet I'll go over. But the three, at least the two biggest things are a good cleanser, depending on your skin type. Benzoyl peroxide is what I recommend to a lot of people. There's like better formulations of it now if you're like oily or combination skin. And then, retinol or actual prescription retinoids are really good as well. But my favorite medication for women with acne, later on in life, is a medication called spironolactone. We use it all the time. It works.
So do we.
Yep. And, we use it at low dose. It's a blood pressure pill. I tell everyone it's kind of like a birth control, but, safe, long-term, minimal side effects. And it works great too. And so it does affect the oil production on the skin. And most women are clear, if not, within a couple, like 4 to 6 months.
Right. And so important, if a woman is still in reproductive phase and still potentially could get pregnant, if she's on spironolactone, she's got to be on birth control. So, of course, using those IUDs, it's so important to make sure we're doing that. And Tracy has a question about acne that I think kind of gets to, what I would want you to address as well is tell me, if you would explain in your words, what is acne? I think it helps so much for people to understand that we all make sebum, or that white stuff, from our skin glands. And if it gets trapped because maybe your skin is dirty or you didn't clean the oil out of it, then the bacteria love to get in that white stuff. And then they grow and it gets inflamed. And that's the red stuff that happens around that bit of acne, or I hate the word pimple, but I don't know what you call it, but that thing. And so, right. And so when we talk about a skincare regimen, it's about clean, potentially an antibiotic ointment or oral. So if you could address.
Yeah, definitely. So, and you summarized it perfectly. So, it all starts with the occlusion, and then the bacteria kind of progresses, and then you get inflammation, and and that can even be from too much sebum production from like the hormones, overactive hormones or imbalances. So, and that's why most people start getting acne in their teens, because hormones start increasing, and then you start getting the increased sebum and occlusion. So, but yeah, just in terms of teenage acne and whatnot, basic skincare regimen. Some people, acne is genetic too, which I think a lot of people don't realize. For example, I have patients that come on. It's not called Accutane anymore, but almost everyone remembers it as Accutane. Most of the time, people that have pretty bad cystic acne with scarring tend to have, at least a family member, if not a sibling, that's been on Accutane. And those, you can kind of predict who's going to need an antibiotic or not. But, acne treatment ranges from topical medications, like you said, topical antibiotics. We're going to have basically a topical spironolactone here soon.
Wow.
We're waiting for it. I don't know if it'll be covered well or not. But unfortunately, acne is still very much revolved around antibiotics, which we're trying to get away from. I tend to be kind of more integrative, and I myself take a supplement that has niacin in it, or nicotinamide, because that can affect oil production, just because, a lot of acne is also, a disruption in your gut bacteria as well, because, the gut does communicate with the skin, and also acne is very much what you eat. So, sugary foods, high glycemic pastas, breads, things like that can all contribute to acne too. But then we do have some great medications like Accutane, which is kind of, explain to everyone as a synthetic vitamin A derivative. So it works really well for acne that's not responding to antibiotics. And then for women, I have spironolactone and birth control as well.
No, I love that. Thank you. And Tracy, it makes a lot of sense that your son's acne cleared up with the antibiotics he got for surgery, because again, that kills the bacteria that are in the acne. And so again, to see someone like Dr. Ashack to talk about a regimen, but time out the fact that you talked about gut biome. I mean, congratulations, because, I love how when we can look at people as the whole picture. And
Right.
I think people get so frustrated when they see a doctor, they just get a prescription and they're sent out the door, right? So when we can really look at somebody, so to look at Tracy's son and say, what is he eating? What is
Right.
his stress like? Is he taking a probiotic? How can we maybe do an antibiotic short term and then transition him off as he sort of is able to look at everything else?
Exactly. And even we have studies now showing that probiotics plus antibiotic have improved outcomes and actually less side effects, especially for women who get yeast infections on antibiotics, virtually
Yeah,
non-existent if you take a probiotic with it, or the right probiotic, I should say.
exactly. And I love probiotics in food. We really recommend just even kombucha, a third of a bottle. Doesn't have a lot of added sugar, especially the Synergy brand.
Right.
Or the yogurt. The Siggy's is a low sugar kefir yogurt, which has a lot more probiotic than an Activia or a different kind of yogurt.
Yeah.
The pills, some work, some don't.
Right.
But so important to have that probiotic every day, or fermented food of some type.
Exactly. And a lot of people also don't realize protein supplements, tends to be, more athletic younger people. I get, but sometimes if medications aren't working, that's where I'll also go into diet or protein supplements, because if you take whey protein, for example, I'll have patients on Accutane who aren't getting better, and then we find out that they are taking whey protein. So I almost always now screen people beforehand, make sure you're not taking that, because, that can also affect, acne as well, especially more truncal acne, I've noticed.
Oh, that's interesting, because I take whey protein and do really well, but yeah, I didn't know that connection, so that's good to know.
Yep.
So thank you. I like you, I just love learning all this stuff.
Yeah.
So topic number 3 would be wrinkles. So,
Yeah.
we don't want wrinkles, and, like I have this little thing that gets a little deeper and I'm just leaving it alone for now. I might have to talk to you about that, but tell us, how can we avoid wrinkles? I think number 1 is sunscreen, right? But tell us about that when you see a woman come in and say.
So yeah, wrinkles, it's just like everything in like medicine, or especially dermatology, is multifactorial. There's lots of factors playing a role in it. So number 1 for sure, sunscreen, to prevent sun, because, especially, so the sun emits different rays. UVA and UVB are the main ones that hit the earth. And UVA is, basically kind of all throughout the day, whereas, UVB is the one that causes skin cancer more so. And that's, from 10 to 4. So what most people don't realize is UVA, which a lot of even like windows and cars don't, block for us, that contributes the most to photo aging. That's going to give you the brown spots and all the other things that, a lot of people come in for and don't like. So number 1, sunscreen, photo protection. As soon as you wake up, first thing I do is wash my face, put a serum on, and then sunscreen, reapply every 2 hours. People say they don't go outside. You drove to the office today, you got sun through that window, you still got to wear sunscreen. No one truly doesn't go outside, sun finds you wherever you are. You can't hide from it. So yeah, number 1, sunscreen, things you can control. If you smoke, obviously cigarette smoke, bad pollutant for the skin, can definitely lead to more wrinkles as well. Facial expressions, which, I love. I am a very expressive person, and I have like a good furrow too, which I should probably fix myself. But, just the facial expressions as well over time create those, furrows that a lot of people come in for and whatnot. And then another big thing that I think a lot of people don't realize, more so like kind of around the mouth, is that, as we get older, we lose first fat and then bone in our mid cheeks. And then a lot of that, dependent gravity brings things down. And that leads to kind of more of like the wrinkles or furrows that people don't like. I've heard some people thinking that gum chewing helps with wrinkles around the mouth. That's actually false. Gum chewing can contribute to wrinkles around the mouth. Sipping through straws, and again, pursing your lips, smoking, again, can do wrinkles around the mouth.
Sure. So, and one thing too, I see all the time, especially when people have the fine wrinkles, so many times women are dehydrated. So that's why water is one of the main seeds. We've got to drink our water. And I can tell if someone's dehydrated across the room as you sip your water.
Yep.
It's so important to drink your water for your skin to look good. And Lynn's asking about collagen, and I was joking. I've got my Isogenics collagen right here. I take one every day, and I actually think it works. But when I first heard about collagen, I don't know about you, but I actually kind of thought it was a hoax. I thought, you and I were both taught when we eat a whole protein, it gets broken down with our stomach acid, and then the amino acids go in our blood and they get used wherever. So what I learned is that certain collagens, and again, I like the isogenic stuff, but if it's coated in a fat, it survives the stomach acid and therefore potentially gets into your system and can be used by your body as collagen. I think it's helping. And
Right.
I even Googled, is collagen a hoax? And I actually found some studies that show there's small people studies, biopsy proven improvement in collagen and skin thickness. So Kurt, I'd love to hear your take on collagen.
And just like you, just from medical school, I was skeptic, and we actually were going to carry a collagen supplement in here not too long ago, and I was like, that doesn't work. There's no good data. And then, of course, there's a published paper that looked at, I think, 19 or 20, different papers of hydrolyzed collagen, just like collagen powder, and it didn't increase wrinkles. Granted, it takes time. Like I tell everyone, 3-6 months, but definitely within 90 days, they notice an improvement in wrinkles. And skin texture in the patients that took collagen. So yeah, I think it's a good thing. A good brand that I know of, Vital Proteins, has a good collagen supplement. I mean, usually it's not flavorful. You can just pour it into your coffee, drink it every day. Anything enteric coating that just can make it through your stomach and get a little bit more absorbed is going to help you. So, I think I am starting to recommend that more now, especially after reading that paper.
Yeah, it's good. And, too, I think about source. And again, I wouldn't say I'm totally vegetarian, but, I can't say that I like the protein from the chicken comb or the cow skin. I like that this is from fish. I don't know. So if that really matters, but I really do think there's something to it. And, if people, but again, it can take time. And, what Lynn also asks is it better to take a supplement or a cream? Any study I've seen, it's a supplement, but it's got to be enteric coated to make it through that stomach acid. Kurt, do you have any sense of the creams?
Yeah, no, I don't know too much about the creams, and there's definitely not any studies about that. I mean, just in terms of like the hyaluronic acid stuff, all that stuff, I used to tell people at least, is better on your skin. But definitely, I mean, I think taking the collagen supplement, it doesn't hurt to do both, honestly, but definitely the supplement I think is worth doing now.
Oh, good. And so I don't have this as a separate topic, but let's jump to Alondra asks about, I have a serious melasma problem. What treatment should I do? Totally not my lane.
Yeah.
What would you recommend?
Well, definitely. So melasma, is also very interesting. And, at a certain point in time, we thought it was just a surface issue, but we actually find that people with melasma, there is a degree of inflammation happening under the skin. So you actually have to be more careful than we used to be with treating it. But number one, like I've said throughout this whole talk so far, sunscreen, sunscreen, sunscreen. So because no matter what we do for melasma, if you're not wearing sunscreen, it's going to kind of be a yo-yo effect, because even when we treat it, it's not gone. It can come back. And so you got to stay sun protected. A supplement that, that I'll recommend here at the end too, that is great. There's one both with and without nicotinamide. So it's called HelioCare. It's basically a fern extract that's been found to be an antioxidant for our skin. So it can help with sun damage. And then also we use it a lot for melasma, and there's some data with that for melasma. So I usually recommend that for my patients. You take one a day. And if you're going to be out in the sun, you can take 2, and it's actually kind of the equivalence of internal SPF of 8. So it doesn't replace sunscreen, but it does protect your skin a little bit. So that's another thing you can do. And then, there's a variety of things. Topical bleaching agents. We use combination creams with bleaching agents. There's a new cream out that's not a prescription yet that you can get called Suspera. That's kind of like the bleaching creams. It's just a little bit more expensive, but that works as well. There's a pill called tranexamic acid, which I think might be maybe more up your wheelhouse, but we have a topical version of that as well that you can use. And then just like some, botanical things like kojic acid has been shown to kind of maintain it as well. So, I mean, the biggest thing is I'll treat patients pretty aggressively up front to get them to where they're at or want to be. But then, once they get off of the bleaching agent, then we kind of have to maintain them with either like a tretinoin or kojic acid or something more gentle, just to kind of prevent it from flaring. But, most people should know that this is something that they're going to deal with. It's never going to fully go away. You'll probably have some flares every once in a while, but we can at least reduce it quite a bit.
Well, bottom line, I didn't quickly take notes there, but it sure sounds like you know what you're doing. So I'm so glad. So I would say see a dermatologist or go see Dr. Ashack, and he'll be able to get you down the right path. And so again, I appreciate that. And my sense is you probably have a handout on that as well.
Yep.
is that you really do
Thank
like
you more
patient
for
education.
because I say so much information like that, and everyone looks at me lost. And like, the handout's what it's for. So
It's good. And if I'm going to use a skincare regimen, I don't use much at all. Like I need step 1, do this. Step 2,
right.
do this, because we're all busy and we just need that simple plan. So
Yep.
I
That's what I
bet
made
you've
for
got
people.
good hands. Another topic we wanted to get to that I know both you and I hear about a lot is hair loss. And I never really got how much this really affects women until I started taking more care of more women in midlife and menopause. But,
Right.
hair loss is so difficult. And there's 2 different types, right? The female pattern where it gets thin everywhere, and
Right.
then the male pattern where there's more of a male pattern.
Right.
So would you like to talk a little bit about how you see that in your practice?
Yeah, definitely. So, and I mean, so for hair loss, and just kind of broaden it, there's hair loss that is called non-scarring, meaning, things like female pattern that can grow back, or like, for example, if you have a baby and you shed hair, that's called telogen effluvium. And then there's some conditions, that we see more in other populations that are called scarring, where it's harder to get the hair back. And so it's important for women to know most commonly for female pattern hair loss is going to be widening of the part, not necessarily, or like decreased density as well, not the recession or the vertex like men get. If you do notice, a recession in the front, while I can't say I haven't seen that, there's other things that could be at play. Are you using tight hairstyles? Are you pulling your hair back constantly? Because traction can cause hair loss in the frontal hairline of women. And then there's also another condition called frontal fibrosing alopecia, where you get that, and then you also kind of lose some of the eyebrow hair as well. But that's a little bit more of a serious condition. So if you notice recession, I would definitely make an appointment to see a dermatologist just to make sure. But in general, just diffuse thinning, reduced density, and widening of the part are what I look for female pattern hair loss.
And just real quick, in terms of like the estrogen loss after a baby, I mean, the same thing can happen in perimenopause, where when we start to really lose estrogen toward late perimenopause and menopause. I had a patient once who was taking estrogen and doing really well. And for some reason, her doctor took it off. He kind of thought, that was enough time. And she lost so much hair instantly. So there wasn't that informed consent that if you choose to go off estrogen, you're going to lose a bunch of hair. And thankfully, it didn't last too long, and we were able to get her back on estrogen safely, and her hair came back. So it really is estrogen dependent. And not saying that estrogen is always part of that treatment plan, but it's a big deal with how much estrogen affects.
Right.
Now, tell me about male pattern. I mean, that can be more, let's say, in a woman with PCO. If you out there have PCO, that's part of it. But that male pattern hair loss that happens with belly fat and chin hair.
Oh yeah, yep, and yeah, definitely, it's going to be more like the vertex of the scalp, and you can get some of the recession in the front, but I feel like I most commonly see more just thinning like right on top of the scalp as well, with that. And when it comes to PCOS and hair loss too, I actually see that a lot in younger women as well. Like even today, like I saw 20-year-olds kind of developing hair loss, and they have PCOS, and so that's something I don't think a lot of people piece together because we're worried about insulin resistance, but you do get the unwanted hair growth. You do get acne with it, and you do get the male pattern hair loss as well.
Yeah, and I love to take care of women with PCO. And so again, I look forward to collaborating with you because, it's just such a big deal, and it affects women, their choices, the rest of their life, if they date, who they date, their cycles, their fertility. And the sooner we get on top of PCO, the better it is. So the regular heavy periods, chin hair, come see us.
Yeah, and then definitely just one plug-in I want to make for hair loss, because I get so many people that come in with biotin supplements. I tell everyone, just the first thing I want you to do is throw away the biotin. So, I don't know where the biotin data came from with hair, because we don't really know much, how that helps hair. You can't find a hair supplement that doesn't have it. So I tend to look for ones that just have a lower dose of it. But plain biotin alone is not helpful for hair growth. And so I don't recommend it. And if anything, it can mess with laboratory tests. If you get your thyroid checked, if you're having chest pain, they check, your cardiac enzymes, or even like testosterone levels. I've heard of being off on the lab because of the way it's run. The biotin interferes with that. So if you're taking biotin and you're watching this, just get a different hair supplement.
I love it. And just maybe real quick, Laura asks, is Renova as effective as tretinoin? So I don't know what Renova is.
Yeah, I'm not quite sure what Renova is.
Laura, what's Renova? So Laura, let us know what that is, and we're going to move on, and then we can come back to that.
Tretinoin. I just looked it up. So yeah, tretinoin. I use tretinoin. I mean, they should be the same thing. So I guess I'm a little confused.
All right, cool. Well, let's move on. Laura, if you give us more information about that, that'd be great. But in terms of the other topic we want to make sure and cover is unwanted hair.
Right.
So can you talk a bit more about that? So I remember I did a Facebook Live on chin hair. I think we had 12,000 views, about 6 months ago. It's a big deal for women to start getting, there's the dark hair and then there's also the peach fuzz. So if you could talk about that a little bit.
Yeah, definitely. And again, commonly see that with like PCOS as well. But yeah, a lot of women come in either like stubble on like the chin and neck, or even like kind of like in the mustache area. So a lot of times, yep. And some people use spironolactone like we do for acne and for hair loss as well. You have to use a higher dose. But honestly, the best thing to do is laser hair removal, in my opinion, just because that's the only thing that's going to kind of destroy the hair follicle and try to prevent it from kind of growing again. The caveat, which I don't think a lot of people realize either, is you have to have pigmented hair. So, like hair color like mine, dark hair, because if it's going to be blonde or white, you need to do something called electrolysis, which it does the same thing. It's just more tedious, and, not as many centers do that. But yeah, definitely I would recommend like laser hair removal, all the way for that.
I hear you. And again, I think you and I are on the same page. What I really tell people is that once that hair follicle gets going, if you shave it, it's going to keep coming back. If you do electrolysis or laser, it will get rid of it.
Right.
But if the health condition stays, so let's say that there's still belly fat or insulin resistance or prediabetes, it promotes that cycle that creates more hair growth. So we really have to get at why they started in the first place. And then we get to use these procedures then they're really effective. Because I don't like it when, someone sees you do laser, it grows back and they're like, well, it didn't work. I'm like, no, it worked for that hair follicle. But we didn't treat the condition that made the hair follicle grow in the first place. So the next one next to it popped right up and you think that it was the same one growing back.
Exactly. Yep. Just getting back to integrative medicine, which is where we're moving towards the future as well.
Love it.
Why?
Love it. I love it. And the last topic we wanted to talk about before we get to our tips and questions is what we call it the lady town. But, it's talking about skin conditions down there of the vulva, of the, around the opening of the vagina. There's a condition that Dr. Ashack and I are very comfortable talking about called lichen sclerosus. And some women will get lichen in other areas, lichen planus, lichen sclerosus. And so, Kurt, I love that you brought that up to me. And it's something we take care of all the time. If you want to talk a little bit about your experience and your background in talking about lichen.
Definitely, because it's like I think I told you, not many people come to me with that complaint. I end up, with other findings on their skin, asking about the questions, down like, in Lady Town, and then finding out that they have issues. And also, like I said, a lot of people don't realize, because, we're not just the skin, we're hair, skin, and nails. And, we do genital complaints, things in the mouth as well. But yeah, because so many women suffer and they don't realize that we can help them, or they don't realize that what they're experiencing is a, skin related condition that has a treatment. And so, unfortunately, a lot of us don't ask. And like, I try to, ask, but, if you don't bring it up and we don't have anything on your skin, we don't necessarily always know. So, things like, vaginal dryness or even itchiness down in that area or in the perineal area between the front and the back, essentially. So sexual discomfort, things like that, those are all questions that we need to be asking more of, but that also you should bring to our attention, because, we're here to help you. And, it doesn't hurt to ask. If there's nothing that we can do, then obviously it doesn't hurt to, bring it up. But, most of the time we have something there to help you. And also with lichen sclerosus, there's a small risk of increased skin cancer down there. So it's definitely really for your health to bring it up as well.
Well, for me, as an OBGYN, we were taught that, lichen sclerosus is not bad until it's thick and white and you're needing to biopsy and rule out cancer. But with all my training with ISHWISH, our Sexual Health Society, I really learned how to recognize lichen sclerosus really early. And even before it becomes risky or increase the risk of cancer, it's those red thin lines that, let's say with sexual intercourse or with, especially with penetration or riding a bike, it's even that skin splits and it heals, and it splits and it heals. And so, the first symptom can be, well, they don't have symptoms maybe until they have pain, but it's more just that itching, or, having intercourse feels like razor blades. So again, women, please don't suffer. Ask myself, ask Dr. Ashack. This is a condition that we can easily treat. And unfortunately, so many women just think it's a yeast infection. They use some over-the-counter stuff that feels better for a little bit, comes back. If it comes back, come see us.
Exactly.
Cool. So we covered Lady Town. That's good.
There you go. That's good.
So I want to get into our 5 tips. I love to always leave people with 5 tips. And again, everyone, this will be recorded. Share this with your friends so that they can see this after the fact. But tip number 1, Kurt, what would you recommend as a good skin care regimen?
So, I tell everyone of my patients 3 things that your skin needs. So sunscreen, retinol, or like a retin-A prescription, and then vitamin C serum. Your skin doesn't need vitamin C, but I mean, with all the pollutants out there and whatnot, I really think it's a necessary ingredient for your skincare regimen. So those 3 things.
As an antioxidant.
Yep, as an antioxidant. It just, you're constantly, if you're not washing your face every day or exfoliating, it just helps kind of fight some of the pollutants that you're encountering every day. So those 3 things will make your skin a lot happier and healthier.
No, I love that. And the topic of retinoids, I have super sensitive skin, so I've learned to start with a really low percentage, or when I prescribe it for people, we'll start with a low and then slowly move up. Do you see that? Is that true that your skin can kind of get used to it?
Right, because oftentimes people are given a prescription of a tretinoin and just not really told what to do, and they use it every night. They get a chemical burn, they stop using it, and then they say they can't use it. So what I have in my handout that I tell everyone, in the progression, I'll back up for a second. So there's retinol, which is what, to be an over-the-counter things that you can buy. There's, adapalene, which is different gel, which is kind of like a next step up that you can still get over the counter now. And then there's prescription retinoids, which have different strengths as well. And so, yeah, definitely if you have drier or even combination skin, I'll give you the lower strength of tretinoin, or have you try adapalene first and then work your way up to that. And, I tell everyone 2 to 3 nights a week, 3 nights a week, really, to have it be beneficial for your skin. You use a small amount, dab it everywhere. It's not a spot treatment, rub it in good. And then I tell everyone you got to moisturize with it either before it, after it, or both, whatever you have to do to get it on there. Your skin gets used to it over time, usually months, not necessarily weeks. So you will be able to tolerate, a hyper prescription over time, but you just take it low and slow, 3 nights a week, and just take it from there.
I like that. Do you start at the 0.025? So Laura's asking, where do you start? So I usually, again, I don't do this a lot, but I would start somebody at a 0.025.
Right. And, when I was training, some people would say you're not doing anything unless you're doing 0.05, which I kind of agree with. So if I ask everyone their skin type, so I always ask, are you dry, are you combination, or are you oily? So oily people, I'll do 0.05. Combination, I'll try 0.05. Sometimes I have to back down. And then if you're, dry or sensitive, I'll try 0.025. But sometimes I find that, even with retinols, they can't tolerate them. And so my favorite, go-to afterwards that's as beneficial as a retinoid is azelaic acid, which you can get over the counter, but then there's a prescription strength as well. And that's my, next best thing for people with dry, sensitive skin who can't tolerate it no matter what they try for retinol.
Sure. And yes, Laura, you can, to answer your question. Just text in the app later. So number 2, best sunscreen. What do you recommend for sunscreen? I know there's ones that contain zinc that are more physical blockage versus SPF.
Yep. And so a big thing that, I tell all my patients too is there's a big article, right before the pandemic that found the chemical sunscreens we do absorb. We probably don't apply it to the degree they did in the study, but you do absorb those chemicals, and they're hormone disruptors. We don't know what that means, overall, but it's probably not good. So I don't use it on my skin, so I don't usually recommend it. So zinc oxide is basically the main ingredient I would recommend. Titanium is usually coupled with zinc, but usually zinc alone is great. My favorite sunscreen is Alta MD. It's micronized. Basically zinc has become such a small particle now. So
what's it called again?
Alta MD.
How do you spell it?
ELTA MD. So their zinc facial sunscreen, you can't even tell. You put it on, it just feels like a moisturizer. And so And now zinc actually is so small that it absorbs and reflects. But yeah, I would only use, the zinc sunscreens. And then if you want, especially, darker skin types, you don't like to be white with the zinc oxide, then you can use the tinted sunscreens, which have iron oxide in them as well. And they look nice and they have like a good feel on the skin too.
Oh, nice. No, that's really cool. Thank you. I'll check that out. Number 3, what supplements do you recommend for the skin? I mean, I definitely take my multivitamins, but what do you
Exactly.
recommend?
So I think a good place to start is probably like a good hair, skin, and nails vitamin, just because it covers everything from vitamin D, all the things your skin needs to be happy, healthy, your nails to prevent them from getting brittle, and also a lot of times it has what your hair needs to help grow as well. My other thing that I'm a big fan of, like I said, is HelioCare. There's HelioCare Advanced, which has 250 milligrams of nicotinamide in there. I actually use that for my acne, and my face is a lot less oily, and I don't get nearly any breakouts anymore since I've taken it. I still use other things, but that was like the one thing that I think made the biggest difference. So that's called HelioCare Advanced. But that's a good supplement. It protects your skin from the sun in addition to external SPF. So that would be like the second thing I
Love
would
that.
take. In
No,
collagen, right? The collagen powder we're going to recommend now,
really? For what?
or that
Oh, for supplement.
stabilized collagen for the skin.
That's right. Okay. But again, I'm going to go for the liquid stuff.
Right,
Okay.
right. Which you have, yeah, we'll get that.
Yeah. And then tips to catch skin cancer. Sorry. So number 4, what are the tips that you'd recommend to catch a skin cancer?
So, especially if you have a lot of moles, I tell everyone always look for something that looks different than the rest of the things on your body. That's number one, because, if you have a lot of moles, it's hard to tell when something's new. I have that issue myself. Anything changing shape, size, or color is definitely something to be a concern. Things that just like don't go away or aren't healing are other things, to kind of keep an eye out for. You can't see your own back. If you have someone who can look at for you every once in a while, tell, spouses, just take a look at your partner's back, every couple months. And if anything's changing, send them in. I get, men and women that will come in with, circles on their back of what the spot that I'm supposed to look at. So it happens all the time. Don't be ashamed to do it. Okay.
Oh, that's awesome. Very cool. And actually, I hate to say I've had a patient who had melanoma of the vulva of the lady town. So even if there's dark spots down there, most women don't look down there. At our clinic, we get out the mirror and we make sure that you know what things look like down there. But it's so important to see, even if you have a really dark spot, to make sure that we check that out and biopsy it as needed. So
Great
I
point.
think, but also what you said is get a skin check by a professional.
Right. But yeah, like you said, a lot of people don't realize you can get melanoma in places the sun doesn't go, in the gluteal area, in the buttock, in the vaginal area. Yeah, it doesn't have to be sun exposed. You can get melanoma anywhere.
Yes, so important. And then number 5, when should people make an appointment with you or your team?
So I think it's a good idea just to come in, once just to get a skin check if you've never seen a skin doctor before. Otherwise, if you see something that's new or changing, or if you just even need help with like your skincare regimen, I think it's a great idea. I tell everyone, just like you get a physical, just like you get your teeth cleaned, you should probably see your dermatologist once a year just to make sure everything's, smooth on the skin.
I agree. Thank you. And you have a beautiful new office on I'm blanking on
East
the
Paris.
Beltline, East Paris. What am I saying? So yeah, so beautiful new office. So I still want to come check it out. Your dad came and checked out True, but I would love to
Yeah,
come
you'll
check
visit
your
us.
office. I'd love that. So I always like to get into 5 questions I want people to be able to ask their healthcare provider. So you're equipped with those questions. So number 1, again, we've covered this a couple different times, but how should I take care of my skin for my age and body type? And again, I think this relates to knowing what's happening as we age. This is a pretty general question, but any thoughts?
So, I mean, yeah, I guess kind of just to reiterate it again,
Yeah.
I guess the best thing is sunscreen. The first thing you should do when you wake up, put sunscreen on at least your face or anything that's to be exposed. Again, like I mentioned before, which I didn't talk about too much, but the UPF clothing, which is like all over the place now, that's really good. And actually, that's better than SPF. You're not putting chemicals on your skin. It's, they have like fashionable materials now, and that's a good thing to do as well. But then just, getting like a skincare, regimen and seeing a dermatologist on a routine basis just to make, make sure everything's still good.
I love that. And I think the other part that we've brought in is know your family history. If
Right.
you have a first-degree relative with melanoma, if there's vitiligo, if there's been hair loss. I mean, again, I think it's so important to ask our family members, what have you dealt with? So you can be empowered to know that. So probably the first question I would ask somebody is, what did your parent do? How did they take care of their skin, and what problems did they have? So just to be aware. Question number 2, I always want you to ask this of your healthcare provider, is what is my phase of ovarian function? So am I in reproductive phase? So am I having regular periods and maybe really predictable skin changes, maybe a little more oily skin, a little bit more acne getting closer to the period? Or in perimenopause, where now that acne really can start to take off, and in early menopause, that's happening more. So it's so important to know your phase of ovarian function so you know what to expect in your skin. Kurt, what about melasma happening more with aging? Do you see that more?
So actually, I feel like I see it more
Did
on
I say that right?
that come in my office. Well, it depends. It's 50-50. I do see, some people around like menopausal time getting it, but I feel like more recently I've noticed a lot more younger women coming in.
And I wonder too if it's just being out in the sun and not putting on the sunscreen,
Yeah.
right?
Yeah, definitely. Yeah.
Exactly. Number 3, again, what supplements? So you've mentioned, we know about vitamin D, of course, calcium. We'd rather have that in the food than in a supplement, 1,200 milligrams a day in the food. And there's
Right.
an app you can get on your phone called the calcium calculator, and you can put in your food and see how much you're getting. You've mentioned nicotinamide.
Yep.
Any other supplements you'd mention?
Yeah. No, I think that covers most of it. But honestly,
Sure.
just to kind of reiterate, supplements are
Probiotic.
great, but remember your diet is first and foremost. I mean, a lot of things we can still get from our diet. Plant-based Mediterranean diet, while that's the most healthiest diet, it's also probably the best for the skin too in terms of nutrients.
Perfect. I love that. Question number 4, when do I use sunscreen? I've heard you say every day, all day.
Even in
Repeat
the winter,
often.
I put it on. In Michigan, I tell most people, from April to October is like the main time when we get enough UV light to cause sun damage. But I just tell people, get in a good habit, put it on every day. Conditions like melasma can get darker from ambient lighting indoors. So it doesn't hurt to, stay protected. So, but yeah, definitely. I mean, the biggest time of day is 10 a.m. to 4 p.m. That's when you get like the worst sun rays. But just, all day, every day.
I love that.
You don't have to worry about the moon though.
There you go. And question number 5 is, what diet changes should I make? Of course, water. We've got the seeds, the good healthy carbs, get off of the sugar, minimize the alcohol. Any other dietary changes?
Nope.
Probiotic?
Yeah, probiotic. Yeah, I think you hit it good.
Okay, good. Excellent. Well, I can't believe it's already been 47 minutes, you guys. I usually try to keep this to 30 minutes, so sorry about that. We've had so much fun talking about the skin and all the common questions that we get. Kurt, thank you so much for joining me tonight, and I look forward to seeing your new office and having my patients get to know you better.
Definitely. Can't wait to see you here. Take care.
Sounds
Thanks
good.
for having me.
Thank you. Everyone, stay safe.